accomplish what we're all about, which is ending the epidemic of AIDS in the Charleston community. So thank you for coming. All y'all media is ready to go. Everybody's good? Okay. Thank you for coming this afternoon and joining me to hear more about this important public health issue. Now, I know for the last year, almost year and a half, all we've been talking about is COVID, right? Well, there are other public health issues in the world, and one of them is the AIDS epidemic. It's still out there. And so, but I got to put in a plug. If you haven't gotten your vaccine yet, get your vaccine. Did you see the article yesterday that the people who are still dying from COVID are the people who have not gotten their vaccine? It makes a difference, folks. Please get a vaccination for COVID-19. So now I got that out of the way, and I wanted to remind everyone and all of our citizens that Charleston 2 years ago became what is known as a fast-track city. A fast-track city to end the AIDS epidemic in this city by the year 2030. And so we set specific goals in 3 areas, and we call it 90-90-90. So the 3 areas are that 90% of people living with HIV know about it, that they even know about it. Did you know that 1 in 7 persons who have AIDS doesn't even know they have it? So that's why testing is so important, y'all. It's so important. And actually, this Sunday is National HIV Testing Day. So that really is what led us to gathering here today to remind folks about that. So the second 90 is that 90% of people who know they have HIV positive actually stay on treatment, because the treatment has come light years from when HIV first, came forward, 30, 40 years ago. If you get treated, you can really suppress what they call your viral load. And so that's the other 90%. And live a normal life. And you get to the point where you become what they call undetectable. And you get to that point, you get the virus so low they can't even detect it. That means you can't even pass it to someone else. You're untransmittable. And so that leads us to this now famous formula. Einstein had E equals MC squared, right? We've got U equals U. It sounds redundant, but it's 2 different words. U's for undetectable equals untransmittable. But it's all a part of bringing this healthcare community together and all our citizens to collaborate, to work together, to have a joint focus of kind of purposeful actions together to end AIDS epidemic here in the Charleston region by 2030. And we're making good progress on those 3 goals. We got 2 of those goals in the 80 percentile range now. We've still got some work on folks who know they have HIV to stay on their protocol and their treatment. So we definitely need to work on that, and I think this last year of COVID probably impacted that a little bit negatively. So I am so honored to have with me really the experts on community health as far as HIV goes and other things. And I'm just going to call all your names and then ask you to come forward one at a time. Dr. Allison Eckert, the first up, is with DHEC she's an infectious disease physician. Then Dr. Toby Fugate, he's an infectious disease physician with Roper St. Francis. Then Mr. Richard Reams, he's Director of Marketing and Development for Palmetto Community Care. Ms. Renee Linyard-Gary, she's Director of Health at Trident United Way. And finally, Ms. Shauna Hasty with DHEC. She's a social worker, and she's going to tee up a little video for us with more information about U equals U. So without further ado, I've probably taken too long already. Dr. Allison Eckert.
Redford, and I'm an infectious disease physician, one of the HIV providers at the Medical University of South Carolina. On behalf of all of MUSC, and in particular our providers and staff, who care for approximately 1,400 children, adolescents, and adults living with HIV in our MUSC Ryan White HIV clinics, I'm thrilled to be here to express our commitment not only to those living with HIV, but also to our commitment to end the HIV epidemic in South Carolina. We are honored to work with SHAPE partners and the City of Charleston to achieve the goals set out by the Fast Track City Initiative. We pledge to use our resources and expertise to help achieve those collaborative goals. Since our HIV clinic was founded in 1991, our focus has been on providing comprehensive, multidisciplinary medical and psychosocial care for people living with HIV all under one roof. Outreach, case management, and social work team members work with medical providers to help overcome financial, social, personal, and medical obstacles to linking and retaining those with HIV in care. We strive to see people with a new diagnosis of HIV within 48 hours, and in most cases we are able to achieve this ambitious goal. We also provide daily walk-in rapid HIV testing and comprehensive HIV prevention services. I'm also here today to tell you the facts about HIV. So fact number 1, HIV has become an easily treatable condition, and with as little as 1 pill once a day, people can live normal, healthy lives. I want to reassure you that you should not be scared to get tested. Knowing your status is the first step to living that normal life. Fact number 2, any person living with HIV in South Carolina receives medical care and medication regardless of an individual's ability to pay. Cost is not a barrier to receiving HIV care. So I would encourage you to make an appointment today if you tested positive for HIV and are not currently in care. Fact number 3, a person living with HIV who is on medication and has an undetectable viral load cannot transmit HIV to another person, including to an unborn child. Many people do not know this, so I'd like to educate you that U equals undetectable equals untransmissible. Fact number 4, there is a highly effective and safe 1 pill once a day, often referred to as PrEP, that a person who does not have HIV can take that will prevent that person from getting HIV. If you test negative for HIV, I would encourage you to discuss PrEP and other prevention options with a knowledgeable medical provider. And the last fact, number 5, many people have HIV, have no symptoms, and do not know they have HIV. I'm hopeful that these facts will not only encourage but inspire you to get tested so you too can know your status. We all should be encouraged by these facts. HIV infection is 100% preventable and 100% treatable. Let's work together so that 100% of South Carolinians know their status and 100% of those living with HIV are undetectable, so everyone can live healthy lives and so that we all make real goals together. Thank you.
Thank you.
Good afternoon, everyone. I'm Dr. Toby Pugate. I'm the medical director of the Life Wellness Center in West Ashley. I want to thank you, Mayor, for your continued support in the fight to prevent HIV here in the Low Country, and also thank you for your leadership the past year and a half during the COVID pandemic. So our clinic was established in 2000, and since that time I can truly say that we have grown and grown. Currently, we have about 1,000 patients. The majority, 900 or so, are HIV positive patients. We have about 115 PrEP patients. We offer primary care. We offer HIV treatment, STD screening, STD treatment, and also HIV prevention. Most recently, we have opened a visual clinic. We're in the process of opening a dental clinic, and we're also beginning to screen for anal cancer. A few weeks ago, as you guys remember, we remembered the 40th anniversary of the first HIV cases in the U.S. That was back in 1981. If you look at treatment wasn't even available until 1987. And the unfortunate thing is the treatment that was available then, it didn't prevent death. It really just stopped the progression of the disease. It sort of slowed it down in a way, but it did prevent death, so people continued to die from HIV. If you fast forward 10 years, it was in the mid-1990s, late 1990s, that we actually got good, solid, effective 3-drug therapy. And that was great, but the issue with it is our patients ended up taking maybe 5, maybe 8 pills a day to treat their infection. So finally in 2006, we got our first one-pill once-a-day regimen. It was called a tripla, and it was a game changer. It made things a lot easier. And if you fast forward to 2012, I feel that 2012 was an epic year for HIV medicine. In 2012, that's the year that Truvada was an FDA approved for PrEP. So that was another game changer. Also in 2012, the data came out that showed that a person living with HIV who takes their medications daily and who has an undetectable viral load, they can't transmit the virus. So that's the whole concept of U equals U. Undetectable equals untransmittable. All these were major game changers in the HIV world. If we come up to modern times in 2020 and 2021, there are still wonderful medications being developed. The one that comes to mind is a new drug called Cabenuva. It's an injectable. It's an injectable drug that's given once a month for the treatment of HIV. And the hope is that in the next year or so that we'll have an injectable for prevention as well. There's even some research into injectable drugs that would be dosed once every 6 months. So all of these are very positive things. So in my opinion, I think that the future of HIV treatment, the future of HIV prevention, is very, very positive. I think if we use the tools that we have in our pockets, that being HIV treatment, HIV prevention, aggressive testing, I think we can achieve our goal of reducing the number of HIV new infections by 2030. So again, thank you. You all have a good weekend.
Thank you, Doctor.
So good afternoon. My name is Richard Greaves, and I'm the Director of Development and Marketing at Palmetto Community Care. And I'm proud to share this moment with such exceptional leadership in this community. I do want to take a moment to say thank you, Mayor Tecklenburg, for your leadership and dedication to using the resources at your disposal to help end this epidemic. I believe one of the phrases that's uttered around and even implied in this leadership is that the challenge that lies before us is delivering these tools to the right people in the right places. And I don't think it's far-fetched to say that we who are gathered here, we're here today to say simply challenge accepted. Your organizations represented on this stage are here together to meet that challenge, and we will continue to do so until this epidemic is genuinely a thing of the past. Palmetto Community Care is here to ensure that no person living with HIV or AIDS goes without medical care, everyday resources, and emotional support. While we who are gathered here in this room might know the importance of the link between testing and medical care, not everybody hearing this or reading this might. As the old PSA might say, knowing is half the battle, and knowing requires testing. Now, 2020 was not a typical year for anybody, and the impacts of COVID are still being felt and addressed to this day. So as we begin to emerge from that pandemic, we at PCC are actively increasing our testing levels to above what they were pre-pandemic. Now, lack of transportation should not be a barrier to keep someone from knowing their HIV status. Lack of transportation should not be a barrier to testing. But of course, as we know in this region, not everybody has the means to travel to an HIV testing site, which is why we partnered with DHEC to pilot a rural testing initiative made possible through our mobile testing unit. We are currently the only agency to offer mobile testing in the rural communities of our Tri-County area. We aim to make sure that everybody has access to the testing that they need and that they deserve. Testing is a step in the right direction, and linkage to medical care is the next. Palmetto Community Care does not simply offer free STI and HIV testing. We offer an immediate linkage to care. Rapid linkage to care will help reach that optimum goal of viral suppression by working with the person to stay medically compliant. And it's virtually eliminating the chance of onward transmission, that U equals U. A person who comes in for free testing at PCC has the option to immediately be linked to care, meet with one of our medical providers, and leave that meeting with the needed medication. So whether a person lives right here in the middle of downtown Charleston or in the furthest parts of Dorchester and Berkeley counties, Palmetto Community Care is steadfast in its commitment to continue to expand our efforts to test and treat those high-risk individuals living in our communities. And if I can be sincere, it's the word steadfast in that statement that hits home for me. Ending this epidemic is and has to be all-inclusive. The collaborative partners on this stage are loyal and unwavering in our commitment to do our part in ending this epidemic. And that means in part coming together to form such initiatives as SHAPE and to be designated as a fast-track city. So we at PCC are proud to stand with our partners to meet this challenge and end this epidemic. We will continue our efforts to educate and empower our community to be tested, to know their status, and have quick access to medical care. We will continue to combat the stigma associated with this epidemic and let our community know simply that you are not alone, and that we will continue to face this challenge together. Thank you.
Good afternoon, everyone. And I'm Renee Lanyard-Gary, the Director of Health at Trinity United Way. First, representing Trinity United Way, I'd like to thank John Tecklenburg for inviting me today and for being here with our partners as we try to end the epidemic. So, here at Trinity United Way, we want to be the leader and in uniting our community to improve lives. And the way that we do that is by our focus on education, financial stability, and health. And under health, we are the backbone and catalyst to many of the collective efforts that were mentioned today. We developed a health improvement strategy called Healthy Tri-County in partnership with our core partners at Roper St. Francis and MUSC, as well as DHEC and amongst 75 other formal members of Healthy Tri-County. And through that collective work, where we know that no one organization can move the needle on issues, pressing issues, such as the HIV epidemic and being part of strategies like Tri-County SHAPE, we come to the table to make sure that our community, our leaders and health professionals have access to the resources and information that's available to them in the Tri-County area. Because our focus is in Berkeley, Charleston, and Dorchester County, but without the work and leadership from the city of Charleston to test some of the many approaches and strategies that we want to align to make sure that we help people who fall out of services, all the great services that they talked about earlier that are available. We have many within our community who know that they're HIV positive, who do not have access to services or need to be linked back into care. And so more recently, one of those collaborative strategies that we work on is with our Tri-County SHAPE team to identify one of the evidence-based practices that we have a stronghold in our community is around the community navigator, community health worker model. And we want to test that approach within this population that are not in care, need access to care through a peer-to-peer model where they will have community health workers in our community who can then put them back into the services that are available through many of the interventions that you hear today from our Ryan White Wellness Clinics at USC and Roper, through our preventable community care services. So we are looking at the approaches to doing that. And a point of exploration, we have begun to look at grant funding to help us move the needle and end the epidemic. And so getting people into care is very important because, as the people before me have stated, being undetectable requires that clinical care. And we want to be that link between people in the community getting back into care so that they can be undetectable. And that is one of the main strategies in our work. Under Healthy Tri-County, we want everyone to be a part, and we invite you to join us in this effort and get to know more about Healthy Tri-County and also be a part of this collective effort in our community to move the needle to end the epidemic.
Thank you.
Good afternoon, everyone. I want to say already, it has been said already, but thank you, Mayor, for all the work you've done. Thank you for all of the partners who stepped on this platform prior to me standing here. I want to thank you as well because you have made my job so much more easier than you would not even imagine. Let me introduce myself. My name is Shauna Hasty. I am the preventative health social worker in the Low Country. And I find very much a lot of pride in being that preventative health social worker. When we think about HIV, when we think about treatment, we don't necessarily understand that we need to make sure that conversation is happening at the same time we're talking about health initiatives or mental health initiatives, because this is a part of what we need to focus on. When I have clients that enter in my office, I understand that I'm not just treating them individually for maybe an STD. I'm impacting these individuals holistically. And that's what happens when they come in your office. We understand as social workers, as partners, that if I don't have food on the table, if I'm stressed out at work, I may not be the best to adhere to my medications or adhere to my treatment. And we want to make sure that these voices are being heard. We want to have on the platform sexual health awareness education, because as we impact, as we teach individuals the importance of knowing their status and the importance of knowing their own bodies, not only do we empower that individual, but we empower that person's family, that person's community. We understand that as an agency of DHEC, we are thinking about this individual holistically. I know many of you, when you say DHEC, you're thinking about the vaccine or some other things that we won't mention right now, but it's all good. It's all good things. We need to make sure that when we say the Department of Health and Environmental Control, that's inclusive of our sexual health. As our partners, when we go to the table to make these decisions, make sure that the individuals that we intend to serve are there at the table as well. So I just want to thank every one of you all. Like I said, you make my job so much easier, because those who come before, these are the individuals that if I have a new HIV, I link them to care with these groups. And it makes my job so much more easier. I can't imagine any other words to say about that. So now I just want to take the time, we have a video just to highlight some of the work that we've done with U equals U. So I'm going to step aside so we can show that video. Thank you so much.
Undetectable equals untransmittable, or U equals U.
An undetectable viral load means undetectable equals untransmittable.
U equals U. Undetectable equals untransmittable.
U equals U. Undetectable equals untransmittable.
Together, we can end the HIV epidemic in South Carolina.
Is that it? Okay.
Could I ask the presenters now to come back up and join me as we close out? And maybe we'll get a picture together with our equation in just a minute. And for you that are on the other side of the camera, there are many other partners here in the room, but these fine folks represent a vibrant partnership to address HIV/AIDS in the Charleston community. We are on a fast track to end this epidemic here in Charleston by the year 2030. It just takes these talented people coming together and promoting testing. So this weekend, on Sunday, is the National HIV Testing Day. And you'll see in our press release many locations, some of these partners sponsoring, where you can get free testing. Again, 1 in 7 people don't even know they have AIDS. So if you have any reason to believe you might be a carrier, go get tested. It won't cost you a thing. And then you'll know to get on some treatment that, it's come, you heard the testimony today. The science has come so far in the last 40 years. There's no reason in the world not to have a vibrant, healthy life, even if you are HIV positive. That's the whole point. We can conquer this epidemic right here in Charleston. So I thank you all these partners, everybody here represented in the room today, for all you're doing. We're really making progress. We are on a fast track to end this epidemic right here in Charleston. Thank you. Any questions from anybody? Yes, ma'am.
I just want to read a comment from someone who's watching the live stream on video. He says, "Y'all are doing so fantastic a job."
Great. Thank you. Thank you for sharing that. All right. Anyone else? Well, God bless. Thank y'all for being with us. And we're going to get around the U versus U equals U display and get a little photo op here and everywhere. Thank you for being with us. And thank you to Katie Richardson, y'all.
Thank you, Mayor.
Katie Richardson, a hand around the applause. I also want to thank Paul Wieters, who is city staff, and he manages our health and wellness committee. He does a remarkable job. job. Thank you, Paul.
And I want to thank the mayor of all the cities in South Carolina that have signed to the fast track cities, Charleston, and the best because of his leadership. And there's I think the mayor of the council here, the shipping city, Richardson. So thank you all for Charleston for leading the way for South Carolina. We're very proud of this city. Thank you very much.
Thank you, Charleston.